Hi everyone, my name is Angela Fang and I am a rising senior in the Biomedicine Academy at the Academies at Inglewood in New Jersey. I am deeply passionate about community service and advocacy. So, for example, at my school, I serve as co-president of the American Red Cross Club, where I have been an active member since my freshman year. And over the years, there have been a lot of volunteering opportunities presented that allowed me to grow closer to the club members and to my community in general. I also lead my own volunteering group outside of school, organizing weekly arts and craft sessions with nursing home residents, which further allows me to connect with my community. And like I've mentioned before, I raise awareness on prevalent issues through digital art on themes like mental health, environmental protection, and most recently, anti-war messaging. In the future, I aspire to become a psychiatrist, working closely with my patients, advocating for accessible healthcare, and eventually making a global impact in mental health equity. Today, I'll be presenting on organoid intelligence, or OI, and how it intersects with mental health, an issue that continues to be a global health priority. While the world has seen advances in mental health awareness, millions of people, particularly in low and middle income countries, still face barriers to care due to stigma, lack of resources, and insufficient research into treatments tailored to diverse populations. Organoid intelligence is an emerging field that uses lab-grown brain organoids, which are tiny clusters of human brain cells, to stimulate neural activity. While OI is still in its early stages, it has the potential to revolutionize how we understand and treat neurological and psychiatric disorders like depression, schizophrenia, and bipolar disorder. These brain organoids allow scientists to model disease at the cellular level, personalize drug testing, and better understand how specific mental health conditions develop, all without relying solely on animal models or one-size-fits-all approaches. However, OI also raises important ethical and societal questions. If these brain organoids become more complex, could they develop consciousness? Who owns the rights to organoids created from donated cells? And how do we ensure that OI advances won't worsen the global mental health divide by benefiting only wealthy countries? This presentation aims to explore not only the scientific promise of OI in mental health research, but also the broader global health implications. By examining how OI could both help and harm the mental health landscape across the world, I hope to encourage thoughtful discussion about the future of medicine, ethics, and equity on a global scale. Like I've said before, OI is built on the use of lab-grown brain organoids, and while this technology is still in early development, it raises one of the most pressing ethical questions in neuroscience and biotechnology today. Are organized objects or subjects? This question is central to how OI is classified, regulated, and eventually applied within healthcare, particularly in areas like mental health, where understanding brain function is crucial. If organoids are considered objects, they're simply research tools, non-sentient, inanimate constructs used to model disease, test drugs, and observe brain development, much like petri dishes or 2D cell cultures. In fact, a study found that current brain organoids are still far from possessing the neural complexity needed for consciousness, and they lack the subjective experience and self-awareness that would qualify them as sentient or alive. However, that may not always be the case. As organoid technology advances, some scientists suggest that organoids might eventually display a form of awareness or cognitive capacity. This presents a serious ethical dilemma. Should organoids then be given moral status? If so, when and how would we define that threshold? The binary classification of subject versus object becomes problematic. Organoids are beginning to exist in a gray area, possessing both object-like utility and subject-like potential traits. To explore these questions, a 2023 study by Robin and colleagues conducted workshops across Italy, Greece, and Denmark to gauge public and stakeholder perceptions of organoid research. Participants included everyday citizens, vulnerable groups like parents of children with genetic disorders, patient organizations, and even religious institutions. They viewed organoids as powerful tools in the fight against diseases like cancer and cystic fibrosis, and especially as a breakthrough in personalized medicine, which includes mental health treatment. With more accurate, patient-specific models of the human brain, OI could lead to new treatments for depression, anxiety, and other neurological disorders that are currently undeserved by one-size-fits-all drug development. Still, participants stressed the need for clear regulatory oversight, fair donor compensation, and protection of bodily autonomy. Many agree that hospitals or research institutions should maintain organoid ownership, but there was also strong support, particularly in Greece, for compensating donors and ensuring informed consent. Perhaps most importantly, the study emphasized the role of public education and inclusion. Involving the public in discussions about biotechnology helps build trust, increase transparency, and avoid public backlash when the technology eventually becomes part of mainstream healthcare. And as we consider OI's future in global mental health, these insights matter. If organoids are going to be part of future treatment strategies, especially in something as personal and complex as the human brain, we must balance innovation with ethics and prioritize equity, autonomy, and public understanding from the very beginning. To conclude, today I presented on organoid intelligence and its ethical implications in the context of global mental health. Organoids represent one of the most groundbreaking developments in biotechnology. They hold incredible promise in modeling mental health disorders, advancing personalized medicine, and helping us better understand the human brain. However, this promise comes with complex ethical questions that must be addressed now, not later. One of the central issues we explored is whether organoids should be considered objects or subjects. And while current evidence shows that brain organoids are not conscious or self-aware, the potential for future developments complicates this binary classification. OI may never become sentient, but even the possibility changes how we ethically treat these tools and how we define intelligence, life, and autonomy in biomedical research. We also examined public perceptions gathered from a multi-country study, which revealed cautious optimism alongside key concerns, especially around governance, ownership, donor rights, and ethical oversight. What this shows is that as much as OI is a scientific issue, it is also a societal one. Public engagement, transparency, and ethical foresight are not optional, they're essential. So, as we look ahead, I leave you with this question. How do we move forward with a technology powerful enough to help cure mental illness without compromising the very humanity we're trying to protect? And whether as future scientists, healthcare providers, or informed citizens, we all have a role to play in ensuring that organoid intelligence is developed ethically, equitably, and responsibly for the benefit of all. Thank you. And that is the end of my presentation, and I would like to thank and acknowledge a fellow peer in the Johns Hopkins Global Health Leader Conference, John Kim. He was the one who had initiated the idea of creating a research paper on the trajectory of OI and AI in the world of medicine. And it was a great challenge and opportunity to further extend our interest and connect it to global health in different ways. And lastly, thank you all for listening this far. And here's my contact information if you wish to reach out, and I look forward to hearing from you all, and thank you again for listening.